Hi everyone, my name is Xie. I'm your host for Occupational Medicine Pearls podcast. Today I will be discussing about hydrogen cyanide. From curriculum point of view, it is covered under Domain 12, Domain 10, Learning Objective 12, and Domain 20. From the details point of view, it is a colorless gas or volatile liquid, depending on the temperature. Apparently, inability to smell hydrogen cyanide is an autosomal recessive trait affecting up to 40% of population. Obviously, we can't rely on odor for hazard detection. Doses of hydrogen cyanide are seen in the gold mining, electroplating, chemical manufacturing. In the gold mining, it is used in leaching. It is one of the main sources of Australian industry in the gold, electroplating in the cyanide-based plating bath. In the chemical manufacturing, it is used in the plastics such as acrylonitrile, methyl methacrylate. So that's one of the important resins, adiponitrile, and cyanuric acid. Historically, it was used as a pesticide in fumigation, and because it is good at gold and electroplating, it may be used in jewelry and metallurgy as well. It is also released as indirect sources, such as combustion of nitrogen-containing materials, such as polyurethane, nylon, or silk, in the industrial fires, and in the blast fume of ANFO, along with the CO, CO2, and NOx, and it tend to accumulate in the confined spaces, which was covered in a previous paper. And there are multiple papers asking in relation to confined space and hydrogen cyanide. Route of exposure, if we think about it, the inhalation is the most important since it is the most rapid other than injecting into the blood, and it can be the most fatal. It is absorbed almost instantly across the alveolar membrane. But don't forget about the skin as well. If it is a solution portion is exposed to the skin, that may penetrate to the skin. GI absorption is possible if you ingest that. Dermal include eyes as well, so mucous membrane can absorb stuff. The speed of action of hydrogen cyanide acts within seconds to minutes after inhalation compared to other occupational toxicants, and it acts quickly and is metabolized quickly. That's important to know. Once it is inside our body, it is distributed to all tissue, highest concentration to liver, lungs, blood, and brain. Especially it is affecting the high tissue with a high energy consumption, and it can cross blood-brain barrier quickly. We can metabolize that in the liver and remove from the urine. You can study more about the metabolism if you like. However, that's very much overview. In the mechanism of toxicity, once the hydrogen cyanide is inhaled, it binds with the cytochrome enzyme, cytochrome C oxidase, and it causes to the oxidative phosphorylation, resulting in histotoxic hypoxia or cellular hypoxia. Since tissues cannot use oxygen, they use anaerobic metabolism, causing severe lactic acidosis. Brain tissue, heart tissue are very vulnerable to acid or imbalanced pH that will cause symptoms as a result. Compared to other asphyxiant, if we take a brief moment to revise, so we have simple asphyxiant and such as CO2, nitrogen, methane, and argon, they just displace oxygen and you are run out of oxygen to breathe. Or we have chemical asphyxiant, hemoglobin bindings such as CO, and other cytochrome bindings such as hydrogen cyanide and hydrogen sulfide. When we comparing with the CO and hydrogen cyanide, there are not that many differences, but there are differences as well as some similarities. CO acts in the hemoglobin, whereas hydrogen cyanide in the cytochrome oxidase. So it is everywhere. CO result in normal auto utilization, but oxygen delivery is impaired because of COHB. Whereas in the hydrogen cyanide poisoning, auto utilization is also blocked as well. If we are looking at the acute hydrogen cyanide poisoning, it depends on the dose. If it is 2 to 5 ppm, there may be smell. It is up from 18 to 36, there may be mild symptoms. Higher is that higher risk of death. If it is more than 100 to 300, it can lead death within 30 to 60 minutes. If it is over 300 ppm, immediate death could pursue. When we are looking at the clinical symptoms, our exposure could cause headache, dizziness, nausea, vomiting, tachycardia, hypertension. In a confined space, when you're exposing to both hydrogen sulfide and hydrogen cyanide, symptoms may be overlap and probably more dangerous. When symptoms, the concentration is higher, there will be more auto-consciousness, severe headache, tachypnea, hypertension, or even shock in the hypertension. Cardiac arrhythmias could happen. And at the fatal dose, high dose, there could be seizures, coma, and cardiovascular collapse. So how do we manage if someone collapses in the workplace, in the setting where they could have exposed to hydrogen cyanide? We should have a similar tactics or approach for anyone with sudden collapse in the workplace. But if we assume that this is a confined space or asphyxiation is happening, the first thing we have to make sure is that people are safe, rescuers are safe, and we need to make sure that when the person is rescued, they receive oxygen. We start with airway breathing circulation. If there are any soily material, we have to decontaminate any dermal or from the eye, from the nose, or the mouth exposure. Important that rescuers are wearing PPE to avoid secondary contamination. Please assume that there is no oxygen or there is toxic gas in someone collapsed. Respiratory PPE such as SCBA are important. Similar to hydrogen sulfide, 100% oxygen is the most important, and we need to transfer to a tertiary hospital. And if you have any bag and mask respiration or any respirator, you can provide that to the worker, but do not perform mouth-to-mouth ventilation due to the risk of exhale HCN. And once we get to the hospital, or if there is any first aid kit in the gold mine, it is called cyano kit. It is hydroxycobalamin, and that is first line antidote, and we could use that if it is available. There are other chemicals, other medicals are also available. So the names such as sodium thiosulfate, dicobalt edentate, so they can be used as well, but might be beyond the scope for our level, and they require ongoing supportive care depending on the symptoms. So when we are looking at workplace control as a hierarchy, if we can eliminate any cyanide in the gold extraction process, that would be good. And the same with plating solutions, there will be no cyanide. And if we're already using cyanide-free fumigants most of the time. From engineering control point of view, we have to design to avoid confined space as possible, ventilation to design so that there is local exhaust ventilation when there are processes that will release hydrogen cyanide, and installation of any gas meter in the places where hydrogen cyanide is available or present. From the administrative control, we should have the same confined space procedure, permit to work system, emergency response plan with availability of cyanide antidotes such as cyano kit, first aid training to how to treat with cyanide poisoning. If it is a significant hazard, all the workers in the area should have training for that. And if someone is going into the area with their exposure risk, buddy systems are useful. And PPE is that appropriate SCBA must be used when we are doing the high-risk tasks or rescuing people. That also include eye protection and gloves as well, face shield, and that's all for this episode. Thank you for listening.